so we're recording. All right, so let me share my screen. We'll make sure I have the right one. Can you guys see my screen? Awesome. Okay, exam 2 covers quite a bit of material, covers weeks 3, 4, and 5. And here's all the chapters up here. I'm a highlighter, so just bear with me. Covers all these chapters. Okay, this is pretty much the same cover sheet as exam 1 review. Okay, there's nothing different. There's a multiple choice questions, all of your favorites, select all that apply. Don't be afraid to select all and select all that apply. I usually go through my mantra when I cover this first page with my strategies. I don't know if you attended my first review, but don't be afraid to select all that apply. Okay. Don't change your answers unless you can convince yourself that you're absolutely correct in changing your answer. Okay. And not, oh, I think I saw this somewhere. I think I read this somewhere. Nope. You have to have concrete knowledge that you need to change that. Okay. Try and read the question. Couple things. Try and read the question first. What I'm saying is before looking at the answers, after you read the question, see if you can come up with an answer in your head. And then go back to the answers and see if that answer's there. It's probably the correct answer. So try and answer it in your head before you read the answers. If it's a long question, try and pull out the information that's maybe not necessary. Try and rephrase the question into something that you understand better. Maybe shorten it. Okay. What are some test taking strategies that you guys use that might be helpful to others? Anybody have any good test taking strategies? Don't go ahead.
In general, like on the test, there's actually a little bit on the right hand side. Once you know that that's not the answer, I tend to mark it out because sometimes you'll be going over it over and over and you keep on and just mark it out so you don't completely ignore it and you can work on the other ones.
That's a great strategy because you can I sent test taking strategy tutorials to you guys at the beginning, and exactly what Nikki just said. In the tutorials, there's good ways to read the question where you can typically eliminate one, if not two answers. Scratch those out at the beginning, then you're down to only a couple to choose from. Only read your question a couple of times. Okay. If you still have no clue after the second time you've read it, make a guess and move on. It's one question. Okay. Do not stay in there and read this question 5, 6, 7, 8, 9 times if you still don't understand it. Okay. Just pick an answer and move on. Okay. That tends to create frustration, maybe anxiety if you are just stuck on a question. Okay, so keep moving with that. What else can I suggest? Don't be afraid to select all that apply. I already said that, but don't be afraid to select all. Okay, when I do reviews with students and it was a select all question and all the answers were correct, typically what the student will say is, oh, I didn't think we could choose all the answers. Yes, you absolutely can. Okay. Some helpful hints about chapters. Please, when you go back and review your chapters, please be mindful of two boxes in each chapter: your healthy people 2030 goals and objectives, and be mindful of your prevention box, your levels of prevention. Okay, these boxes are in every chapter, and they apply to the topic that's being covered in the chapter. Okay. So those are, I mean, at this point, we should have a really good understanding of the difference between primary, secondary, and tertiary, right? And the other thing, when you're reading this study guide, when you read a paragraph or a sentence in here, try and think, why are they giving me this information? What question might I be asked? Okay. So from the study guide, try and develop your own questions in your head. What might be asked? And the study guide is not meant to be memorized at all. It's more for understanding. The study guide is simply a review of what we have been covering over the last 3 weeks. Okay. The study guide is made from your resources. It's created from the lectures. It's created from the PowerPoints. It's created from the book. So the study guide is we have reviewed all of your resources leading up to the exam. Okay. Let's see. Not an all-inclusive study guide. Best practice is to review your notes, your recordings. If you missed a class, please review the recording. If you missed part of a class, go back and find that recording and review the part that you missed. Okay. We also use not information, but your discussion questions, your assignments leading up to this exam. That plays into the study guide in the exam as well. Okay. And then obviously you're attending this session, which is great. Okay. What I always offer my students is after you've done all your preparation for the exam, you've done your own due diligence, right? You have studied, you have picked, if you go through the study guide and see areas that you don't know, don't just read it and memorize it. Go back and do your due diligence and get a better understanding of the information, whether it's going back to the lecture, going back to the book. Does that make sense? Okay. Okay. Here are some of the concepts we covered over the last couple of weeks. Big topic was rural health and migrant health care, right? And cultural considerations for them. Okay. A couple of things we're asking you to do. Review the consequences of poverty in rural areas. Okay. Excuse me. The group that's at highest risk in rural populations are the kids. Okay. The kids, minority, racial, and ethnic groups, single parent families. Okay. Especially those headed by women. Okay. So thinking about that, what kind of question might come up on the exam? Maybe who are the high risk populations in the rural and migrant community? And who are they? Children, minority, racial, and ethnic groups, single parent families. Okay. Next is physical demands of harvesting crops. And don't just review what I'm highlighting. I'm just highlighting what I think are the main points of each bullet. Okay. Physical demands of harvesting crops, 12 to 14 hours a day working. Okay. So you you may get asked about, I don't know, what are the effects of harvesting crops 12 to 14 hours a day? Okay. Musculoskeletal issues, back and neck pain. Right here, back and neck pain are the most common types of chronic pain. Okay. Identify health risks for clients in rural communities who don't seek care. What do we know about rural population? What do we know about their perceptions of healthcare? I'm asking you guys, what do we know? Are they really into their primary care and prevention?
No, they usually wait until last minute. They don't have access. They live further. They don't have
Yep.
cars, maybe. Maybe they don't know the language, so they're
Right.
that stops them.
Right. So this bullet talks about barriers. Okay. It's really important to understand what the barriers are of why people in the rural and migrant community don't seek healthcare. We know that Nikki's absolutely right. She just mentioned lots of barriers. Access is a big barrier. Transportation is a big barrier. Language is a big barrier. So, if you're in rural nursing, your focus is on health prevention. And when we finally see these clients, they're usually at an advanced stage of whatever diagnosis, condition, disease they have. Accidents are very common in the rural community because of all the machinery and equipment they're using. Okay. And we certainly know that rural populations are much less healthy than their urban counterparts for exactly this reason. If you read just the beginning of each of these bullets, it's asking you what to do. Okay, so you need to know the barriers that exist, which we just talked about. Okay, lack of anonymity. Why is that a big barrier in the rural community? What does that mean?
Everybody knows everybody's business.
That's exactly right. And so people are reluctant to seek health care. A lot of issues that go on in the rural community and involve substance abuse, mental health, violence, child abuse, child neglect. And, once they show up at the hospital, everybody's going to know what's going on. So, like preventative care, we don't see them until they're typically in a more advanced stage of their disease. Well, we don't typically see them in the urgent cares or emergency rooms with these kinds of issues until it's a crisis level, whether it's abuse or, like I said, domestic abuse, partner abuse, child abuse, substance abuse, mental health issues, for that anonymity reason. Sexual assault is very common in the rural areas. Likely won't see that until it's at a crisis level. Okay. We would like for you to review primary, secondary, Healthy People 2030 objectives regarding pesticide exposure. In the rural chapter, that's exactly what your prevention level box is about. It's about pesticide exposure, right? So let's go through that. What would be a primary intervention strategy for pesticide exposure? What's primary? Trying to prevent
Education.
Education.
Proper PPE.
Pardon me?
Proper PPE.
Mm-hmm. Provide education, teach workers how to reduce their exposure. What about secondary? Secondary is screening. We're trying to screen for at-risk clients. So in this particular topic of rural health, we would be screening who is at risk for pesticide exposures, right? So here, provide hand washing stations, conduct screening such as urine testing for pesticide exposure. So we're trying to secondary is early identification early intervention. And then for tertiary, we have to assume that they have been exposed to a pesticide, right? So you'd be treating them for symptoms. And it's tertiary because they've been exposed. Why are we asking you to know the cultural considerations regarding the Mexican culture when it comes to rural and migrant populations? Why are we asking you to be aware of Mexican culture? Because many of the migrants that come are from Mexico. So we feel it's important for you to know cultural values, beliefs, practices in the Mexican culture. And this bullet talks about that. Okay. So we've broken this up with the big topics we've been covering. So that's rural. Then we talk about vulnerable populations. Okay. So here's a fact. Families with children are the fastest growing segment in the homeless population. That's pretty important to know. Okay, this next bullet talks about HIV. Okay, it talks about how it's transmitted. And there's a lot of information in this. HIV is transmitted in several ways. So maybe you'll get a question about how HIV is transmitted, whether it's select all or apply or pick one, but this is about how HIV is transmitted. And it also talks about clients who are at high risk. High risk categories include, okay, so there's lots of information in this bullet. It's how it's transmitted, there's how it's transmitted, and who's at high risk. Okay, we have a few categories: individuals who use IV drugs, persistent individuals who have current and recurrent sexually transmitted infections, and individuals who have multiple sex partners. Those are your three high risk groups. So you have to be able to read each bullet here and pull out the important information. So when we talk about HIV, here we're talking about how it's transmitted and who is high risk. Next is about homeless adolescents living on the streets. Much higher risk than your typical homeless population. Homeless adolescent. Why are homeless adolescents exhibiting greater risk-taking behaviors? And what are their risks? Right, they're at risk for contracting communicable diseases, AIDS, hepatitis, and they're also more likely to use alcohol and illicit substances. So what do we take from that bullet? We take that number one, homeless adolescents are at much higher risk. And what are they at risk for? So I'm kind of just trying to help you organize how to study. Now, if you don't recall these topics being discussed in class, then you need to do your due diligence. Oh, obviously I didn't finish my thought on due diligence and reviewing for the exam. When you go through the study guide and there's areas that don't seem familiar or you're having a hard time understanding it, go back and do your due diligence, whether it's listening to the recording, reading that section in the book. And then after you've gone to a review, you've listened to a recordings. If there's still some concepts and topics that you don't understand, set up an appointment with me and we'll review those before the exam. but I need you to do your work as well. I'm happy to meet with anybody before the exam for areas that they don't understand. Okay, this next bullet is about single motherhood. Single motherhood is increasing. We know that. Okay, and we also know there's a direct correlation in this population, single motherhood, between education and poverty. Direct correlation. Okay, we also know that lack of education, poverty, single motherhood increases the chances of poor health outcomes. Okay, so this paragraph discusses teens who are at risk because of lack of education and poverty. So for example, I think it should be in here. One of the most important things, and I talked about this in my lecture last week, was with teen pregnant moms. One of the most important things to do is keep them in school, right? We try and encourage them to stay in school because we know that if the more education they can get, the chances increase for a better future, better outcome for both them and the baby across the lifespan. And here it is right here. It's important to keep pregnant adolescent in school during the pregnancy and have them return as soon as possible. There is a direct correlation with increased education and better outcomes for the teen pregnant client. Primary prevention in alcohol, right? We've got to be aware of the dangers of mixing drugs, medications, and alcohol. Think of this question. What kind of discharge teaching would you do with medications that depress the central nervous system and mix with alcohol? Let's say you're the nurse and you're discharging a patient and you know they have a history of alcohol abuse and you're discharging them on certain medications that may affect their CNS system. Okay? So know the dangers. Okay? This next bullet talks about how can we, as nurses, community mental health providers, help create, what can we do to help reduce the culture of youth violence? Okay, and this gives some examples: creating coalitions and partnerships, providing activities that increase social skills, helping them learn to stop, think, and act. So there's your three answers to that question. If you get asked a question, what can we do in the community to help reduce the culture of youth violence? Here's our three answers: creating coalitions, providing activities to increase social skills, and helping them learn to stop, think, and act. That's how I want you to think about this study guide. What's in the bullet and what questions might be asked. Okay, and here we're talking about homeless people having access. Why? Why is it access an issue with homeless? Well, lack of money, lack of insurance, lack of transportation, right? And when do we finally see the homeless population? Kind of like the rural and migrant, we see them in the hospital setting when it's at a crisis level, which creates big burdens, big financial burdens on hospital systems when they're not, homeless people are not focused on primary. They're just not. Okay, so it's the same issue with rural and migrant. Okay. The next section is about alcohol, tobacco, and other drugs. Okay, we're asking you here to review Healthy People 2020-2030 concerns with tobacco. Okay, so you need to go to that chapter and you need to review that Healthy People 2030 box. this tells me that you're probably going to get a question. I mean, this isn't mentioned in every section. So this tells me you're probably going to get a question about Healthy People 2030 objectives with regards to tobacco. Okay. And keep reading through this. It is preventable. And how do community nurses develop programs? You need to think primary, secondary, and tertiary prevention. What are some risk factors? Here, review how psychological dependence can occur with chronic use and what drugs are safer to use. That's all in that chapter. Review the benefits of harm reduction. One of our biggest goals working with this population is harm reduction. We talked about that in class. And then also asking, what are the risk factors? What are the risk factors for the vulnerable that cause these kinds of problems? You need to be able to answer all the questions that we're asking in this study guide. Okay. Nicotine ingredients. Okay, know the dangers and how would a community nurse provide teaching on vaping products and exposure? All right, so how are we going to teach? Asking what would some primary, tertiary points be for teaching and prevention? Okay, you got to think about e-cigarettes. Let's say you're working with a family in the community that is a smoking household, and your goal is to making it a non-smoking household. What do you do? Well, some primary would be you would try and teach the parents the dangers of secondhand smoke, long-term effects of secondhand smoke on the kids. But also think of, what would the parents say that might concern you? Oh, we vape now. We're okay. We're good now. We vape. Is that? No. And that's why we want you to know about nicotine ingredients. I mean, vaping is just as dangerous as cigarettes, or harmful. Okay. And then the section on your faith community nurse, right? Know the difference, review the definitions, and provide examples of congregational based and institutional based. Do you guys remember what those are? What's congregational based faith nursing? Who are your clients? I mean, where are you working?
You're working with the congregation community.
Yep. You're responsible for the congregation itself. You're working within the congregation. When you get into institutional based, that means you're partnering with the community for services. Okay, so if the goal is just simply to visit new families, new teen families, or new families that have just had new babies, that could be done within the congregational based. But let's say for your older population, you need wound care, you need IV care, you need home health services. Those are contracted with outside community resources. And so that becomes an institutional based. You're working with outside services to also support your congregation. So that's what we call institutional. Know what some of the spiritual activities a parish nurse would include as interventions when providing care. That's all laid out for you in that chapter in the book, spiritual activities. And remember, that's what the faith-based nurse adds. Holistic care, bringing the spiritual side into it. Okay, we need to know the differences between religiosity and spirituality. What are they? Remember, religiosity, you're dealing with one religion, whatever it is. Okay, it's how you think it's a group of people congregating together to practice one religion. Okay, but spirituality is your view of the big picture. your how you think of the spiritual aspects of your life as a whole. Okay? Spirituality. Okay? Review the nursing functions of hospice and provide an example. We went through that. I believe that was one of your attestation questions. Okay, this bullet is about care plans and nursing process, your ADPI. Okay. And it asks you, how do you think of ADPI when you're working with clients? You're trying to come up with goals, right? You're gathering history. Okay, this is all part of the assessment phase. Then you do your nursing diagnosis, then you plan, and you implement your plan and you evaluate your plan. And then review the requirements for Medicaid coverage. Okay, there's a difference between how Medicaid and Medicare reimburse for skilled nursing care. All right, so that's what this is about. So if you're caring for a new wound and teaching families how to provide the care, that's skill-based. Okay, so when you think about Medicaid, Medicare, with Medicare, they'll reimburse based on the skills you're providing, wound care, teaching families, where they won't reimburse if it's ADLs, those kinds of things. It has to be skills based. So that's what this paragraph is about. Okay. Nursing services must be considered skilled. Okay. But other services, sitter services, assistance with ADLs, that's not sufficient enough to be reimbursed. Okay. Remember the differences between Medicare and Medicaid. Okay. Really important. Medicaid is for those 65 and over or disabled at any age. Okay. It's a federal insurance program administered by Social Security Administration. So that's the definition of Medicare. Medicaid is needs-based. Okay? Medicaid is based on the client's lack of financial resources. Okay? But keep reading through it, okay? Medicare will only pay for home health by skilled professionals. Know the primary goal of hospice and the focus on care. So if you can't answer that question now, you need to go back and review what is the primary goal of hospice. Okay, and this is what we're going to cover this week in class. Okay, epidemiology. What's the definition? How it applies? If you haven't read in your announcement, there is an excellent beginning section in your announcement, in your week 5 announcement. I don't know if you skip down to the, what's due, what's due and whatever, all the information, but please go back and read the introduction section of your announcement. Really gives a nice summary of what does epidemiology mean in the nursing field. So go back and read that, okay? So know the definition of epidemiology and how it applies to infectious epidemics. Okay? So here, know the definition of epidemiology. Know the definition of analytic epidemiology and examples. Okay? Oops, I didn't mean to do that. Know the definitions, what's the agent, the host, and the environment. We're going to talk about that this week in class. Okay? The agent is the whatever, let's say COVID. The agent's COVID. The host is us. And the environment is, are we at home? Are we in a nursing home? Are we at a school? The environment plays a role in how the agent and the host interact. Okay. I really want to not skip through this section because we're going to talk about this more in detail. So what I would suggest you do is in class this week, you will learn all about this and then go back to your study guide and make sure all of this was covered. Okay. This week, we're going to talk about environmental health, lots of environmental risks for clients in the community. Where do you live? Do you live near an airport? Do you live near railroad tracks? Do you live near a waste site? Okay, what are the risks? We're going to talk about case fatality rates. So I don't want to confuse you because you haven't had this content yet, right? We know that individuals with immune deficiencies are at higher risk. What are some interventions we as nurses can do to help keep the environment safe? Here, review Healthy People 2030 objectives for environmental health. What's the role of the occupational nurse? Remember, occupational health is the workplace, the work environment. We're going to learn about that this week. And then here's your review principles of the epidemiological triangle, that the agent, the host, and the environment. Why do community nurses need to know about epidemiology? This is something we'll cover this week. Know the definition of incident, risk, and prevalence. Right? This week is really definition focused. Know the definition of the different kinds of study designs for epidemiology. Is it an ecologic study? Is it a cross-sectional study? Retrospective? We're going to go over that this week or today for me. And then we want you to know about the WHO. That comes up this week. What is their mission and principles? How do they apply this to Healthy People 2030 initiatives? Okay, and then we're going to talk about OSHA this week. OSHA is very involved with occupational health, occupational safe and health, occupational safety and health administration. Very involved with occupational health. They're the ones who set the guidelines. You know, I know everybody in everybody's workplace, you've all heard about OSHA. They are required to make sure that your workplace is implementing safety measures for all employees to reduce risk for whatever, accidents, needle sticks, blood, how we handle blood, falls. Okay. So we'll cover this all this week. So that's your study guide, broken down into very specific areas. Questions? Helpful? Okay.
Yes.
Yeah. Start with your study guide in your review. If you don't understand it, don't try and memorize it. I want you to understand it, not memorize it. Okay? Anybody have any questions? Please put your name and your professor in the chat if you already haven't. I need to send out the attendance and the recording. I'll send out the recording to all your professors, and they should be posting this in your announcements. I'll do it after I teach today, but there's lots of reviews this week. from all the different professors. You should, by the end of the weekend, have the opportunity to go to several review sessions, and you'll have all the recordings. Okay. No questions? Well, I hope this was helpful. And reach out to your professors if you have any questions, okay? Okay. You guys have a good day.
Thank you. You too.
You're welcome.
Sure. What days do you have a class? Because I have clinicals tomorrow and it falls during my class time.
I'm sorry, what?
I'm trying to check with you what days you have